Hi, thanks for joining me in my video. My name is Stephanie Piedrahita and I will be discussing standardized testing using the Connect, Extend, and Challenge routine. When entering this module, I already knew how important it was to detect developmental delays and other atypical behaviors in young children. So as someone who strongly advocates for early intervention, I've always believed that identifying challenges early gives children the best chance for success. I've seen firsthand how developmental screenings and referrals can change a child's learning path. This content made me think about resources that I've come across before, such as the ABLLs used as clinicians at my workplace, and even professional tools like the ASQs used at a preschool setting. These helped me recognize how early assessments are often the first step in getting support. This module really extended my understanding of standardized testing, especially in terms of how complex and specific it has to be. I learned that a good test should have validity, which means that it must truly measure what it is intended to measure. That idea truly stuck with me because I hadn't really grasped how different types of validity applies to depending on the test purpose. It also pushed me to consider the way that we design the tests for young children. We often ask them to complete tasks that don't reflect how they learn best. This made me realize that we really do have a need to address the tests that we provide to help children be tested using hands-on activities and truly gauge their developmental levels. It also deepens my appreciation for the role of thoughtful assessment designs, equity, and early learning. One area I'm still finding challenging is knowing how to choose a test that is truly appropriate and aligned with the specific concerns that are found for each individual child, especially one who may show signs of atypical development. There are so many test options, but not all are developmentally appropriate or reliable. I also wonder how clinicians and educators stay up to date with the most recent screenings available. These are real-life factors that can be addressed at a very early age using the appropriate assessment tool. It is important to advocate also for better training and support for better assessments that are fair, useful, and child-centered. I have included a developmental journey chart. This chart will include information as to where developmentally a child should be all the way through the age of 5. Thank you for tuning in to my standardized testing review.